driving the care into the future of medicine. And so, I'm a big fan of the kind of care that Oshi often provides, for instance. And I know we talked about how Salvo is different, but I think it's very different because our sort of reason for existence is to sort of help local community independent GI practices move into the 21st century and bring the best of technology and wraparound care, but particularly that work with them. Only these GIs can do the colonoscopies and endoscopies and escalations and the like. And so rather than bypassing the local GI, Salvo is about empowering these local practices with a lot of tech and ancillary care as a profit center, but also keeping them under the sort of brand and care of the local GI, under the GI, but augmenting that physician with all this kind of outsourced staff in GI psychology and dietitians and the like. And so rather than the patients, essentially, I always say this, the model that first came in GI innovation was, hey, we're going to partner with United Healthcare or Aetna or the like, and they're going to send a letter to everyone in Atlanta saying, hey, forget your local GI, come see our cloud, GI service. And it comes from the CEO of United Healthcare or the like. And, there are a portion of patients who will respond to that. And I think, Oshi or Cylinder can have a very successful business. But I would argue that in this world of AI, human trust really matters. And I think, in fact, to transform healthcare, we need to leverage the trust in those trusted relationships, which still exist in this world of AI. In fact, they're almost more valuable with your primary care physician who sends you to a trusted local GI. And when that GI says, I want you to do this program for your MASLD or your IBS with a dietitian and a GI psychology program, I'll be your physician, but you'll have daily support for the next sort of 6 to 9 months for a personalized plan. That's a very trusted introduction to this kind of wraparound care, and I think really valuable. And it's also important that we can escalate back to the local GI. So Salvo was designed to be strategic partners for GIs, because when the care is driven by an insurance company, you can bet that there's a huge premium, not on what the physician thinks is the right medical care, but on what will bend the cost curve. And I actually think the right way to bend the cost curve is better healthcare that keeps people out of ERs and addresses a variety of chronic ailments, and not by denying patients the right medication or the right kind of procedure. And so if you're a GI, particularly an independent GI in a sophisticated practice, I think what Salvo offers, which is we're going to be your partner, we're going to help you understand how AI can data mine your data and build much more longitudinal data on each patient. We're going to eventually prepare for value-based care arrangements where you can show higher quality of care and better outcomes and more ER avoidance and all that. So we're really deeply the partner augmenting the local physician instead of bypassing the physician. And I think that's a really big difference with the